They're often referred to as the backbone of the healthcare system. But when nurses work long shifts and are constantly bombarded with distractions, they can burn out pretty quickly. Medical reporter Mark Charter joins us now with more. Mark?
Well, Ellen, ICU nurses tell me St. A's decided to put them through training sessions that didn't just have them reading through mountains of paperwork. Hospitals can be chaotic.
This is one I run to.
Especially in areas like the intensive care unit.
Something alarms suddenly 3 times in a row, that's when we run to. If a ventilator is going off, it makes a honk. And so that's a different sounding alarm. So because the alarms all sound differently, we kind of know how to prioritize our care.
But even nurses who have been practicing for more than 2 decades say the constant noise wears on them after a while.
And I think that's where we become a little bit tuned out, because it is the same IV pump every day on every patient.
So St. A's decided to get hands-on.
We role-played out on video a situation where an alarm was going off frequently and the nurse just ignored it.
And nurses say the experience was pretty eye-opening.
It, kind of made us more alert, as this could happen to us on a daily basis because we do experience so many alarms.
As you can imagine, alarm fatigue can kill a patient. So, along with the training, some units at St. A's have turned to team nursing.
You have numerous patients, you have nurse aides, everyone is checking in on that patient, checking the alarms when they beep, checking nurse call lights, and then we have hourly rounding too.
So whether someone is there for an outpatient procedure or something a little more serious, you can bet that the nurses at St. A's have a handle on each and every one of their patients. All right, now this is kind of interesting. A survey released earlier this year says hospital staff across the country are exposed to an average of 350 alarms per bed per day. Now that was based on a sample from an intensive care unit at Johns Hopkins Hospital in Baltimore. Ellen, back to you.
That is a lot. Thanks, Mark.